So, but I found from my personal experience, the population that is really neglected are the families and loved ones and partners of the people that have dependencies. The trauma they go through is tremendous. And I'm going to talk about that tomorrow, as well as problems with kids, teens with dependencies. So I'll be covering some of that tomorrow. So my focus today is on the adult population dealing with recovery. So first, I'm going to give you some numbers about substance abuse dependence and behavior activity dependencies. Then an overview of, there's actually over 11 recovery programs out there besides the one that everybody knows about, which is AA. There are many other programs out there besides that, so people have choices. And my whole goal is to make you aware that there are choices for your clients out there to decide what they want to do for their recovery. There's programs available in for adults, teens, college age, in prisons, that's called Inside Out, in VA hospitals, behavioral health programs, recovery programs. There's smart recoveries available everywhere. It's just that people haven't heard about it. It's been around for 27 years now. It was started back in the 1970s and didn't really become into full action until 76. So it's a program that is relatively new compared to other programs. Smart Recovery is an international organization. I'm used to touch screen. Hang on. Oh yeah, Smart Recovery stands for Self-Management and Recovery Training. The self-management is the very key part of Smart Recovery. It's not a lifelong program. There are no sponsors. We aim to teach people to self-manage their thoughts and feelings and actions. Okay, so what I'm going to talk about is the different programs available, how bad the problem is out there, using the Smart Recovery approach, which is rational emotive behavioral therapy, cognitive behavioral therapy, which we all heard about way back in undergrad psychology. Then I'll talk about what's the philosophy of Smart Recovery, and then there's over 15 different tools that we help people learn to use as they work on their recovery. And then just a brief view of the over 60 meetings that are available online, and those are international. We're also in Australia, Great Britain, Canada, Mexico, and over 30 different countries with over 20 different handbooks in people's different languages. So it's really out there a lot. And then, of course, the usual references. This is the magnitude of the problem across the country. And if you can see the Missouri map, which I don't want to touch this. I'm an Apple person, so droids just... you can see Missouri has really all different levels of dependency issues. I was surprised to see that St. Louis is lower than the northeast counties, and the southwest counties are the lowest, which was a surprise to me. I didn't expect to see that. But the percentages, which will be on another screen that you'll be able to see. There, okay. The problem is primarily mental health issues. People want a quick and easy way to manage their dependencies, their stress, their anxiety, their depression, their trauma. So there's a big overlap between mental health diagnosis and substance abuses and activity abuses. So of the people with drug dependencies, there are probably 3 in 8 people that use illicit drugs. 3 in 4 of those with mental health issues use alcohol. And 1 in 8 struggle with illicit drugs and alcohol with a mental health diagnosis. That's lots of millions of people. It's not little, it's big. Alcohol being the hugest one, and people just don't want to admit or realize that they have an issue. It's very embarrassing, but their family sure as hell know it. So this is 18 years of age and older with any serious mental illness, their substance abuse. So for illicit drugs over the past year, of the 49% of people that have mental illness, 37% of them are using some kind of drugs. Marijuana in the past year is not quite as high. Opioids is lower until we got into the pandemic. And then the binging alcohol, especially with mental illness, is pretty big. And cigarettes, as we all know, people with mental illness, they're probably one of the biggest smoking populations that exist, which is also another dependency. And we help people with that one also. Toughest one there is. I used to be a transplant coordinator and work with liver patients. And of all the dependencies to help people to get over, cigarettes were the toughest one. Had to get brutal. Serious mental illness is rising among young adults. 18 to 25-year-olds and 26 to 49-year-olds. If you look at how many are of the age population we're talking about, the 15 to 25, they make up the biggest percentage. Their brains are still developing up until age 24, 25. So when you see someone who may be recovering from substance abuse and they act like a 12-year-old, that's how long they've been using, is since that age. And I'll go over more of that tomorrow. So the adults between 26 and 49 is still a pretty good percentage, but the majority of people do not get any treatment. You know the biggest cause of liver disease? It's not hepatitis C, not necessarily the alcohol. It's the fat in the liver. Fat in the liver causes cirrhosis, going back to my old job. But people don't realize, I mean, the contribution that alcohol makes to that is huge. But our society is just getting bigger and bigger and bigger. And so more and more liver disease is starting to happen. And you can't just blame it all on drinking. It's obesity. I used to treat hepatitis C too. Thank goodness now it's a 1 pill a day routine. Among pregnant women, the use, fortunately, as of these statistics in 2018, the substance use among pregnant women is going down. So we're getting the word out. I've seen that be the biggest thing to help people stop using is when they get pregnant, they suddenly realize what they're doing, not just to themselves, but potentially another person. And that really hits home for people. Now, if men could just get pregnant, we could have a lot more help that way. Not happening. They could all become Arnold Schwarzenegger Jr. Yeah, the movie. Yeah. So illicit drug use. Marijuana is actually the most used drug. And because now that we've got, medicinal marijuana, that is increasing. And did you know the purity of the medicinal marijuana is not guaranteed? That can get mixed with other drugs just as well. Yeah, it's not pure stuff. So the psychotherapeutic drugs that are being abused come second. Cocaine, hallucinogens, methamphetamines, inhalants, and heroin. Inhalants, that's what the kids start with, most of them, because you can just get it over the counter. There's a lot of inhalants now that you have to be carded for to get when you check out at the store. It always surprises me. Come on. So the past year, people aged 12, starting at age 12, they did these surveys. What was the biggest one? It's the easiest one to get, alcohol. They get somebody to buy it for them, or they drink their parents' supply. Not hard at all to stand outside of a quick stop and give somebody some money to buy you some alcohol and bring it out and give it to you. That's frequently how it's done. And they all drink together. Starts age 8, 9, 10, 11, 12 in that area. Again, it depends upon what their home life is like. Do they want to be numb to all the chaos and trauma and abuse that's happening around them, especially now during COVID? Then cigarettes, but again, marijuana is pretty well up there. Pain relievers, grab them from their parents, grandparents, they buy them from their friends. Tranquilizers, hallucinogens. Stimulant misuse is not the same as the meth misuse, it's other stimulants. Cocaine, inhalants, sedative misuse, methamphetamine, heroin. I was surprised that heroin was the lowest, but it's the harder to get. And all of these, since COVID-19 hit, it's almost all laced with fentanyl. Hence, what's happened to our OD rate, our death rate related to drugs. These people don't know what they're getting. Fentanyl costs pennies to mix with whatever it is they're selling. And it's being imported from Mexico and China. They take a little bit of that and they don't know or care how much they're throwing into whatever it is they're selling. And it used to be that when people would be coming out of rehab, they would go for a fix and use the dose that they had last used before they went in. But now it's people not trying to overdose, not trying to increase what they're doing, not people coming out of rehab. It's anyone who is using has the risk, and it's mostly cofentanyl, the elephant tranquilizer, that they're getting. So now it's become a really serious thing. And because drugs are harder to get now, they've been adding more fentanyl to their things since the beginning of COVID. So that's really where this overdose rate is coming from, is the fentanyl. Okay. Despite consequences and disease burden, treatment gap remains. We are not getting people to treatment, nor are they wanting to come. And so there's a big disparity between the people that have the dependencies and the people that are getting treatment. Multiple reasons. Cost. To get into someplace like a regular mental health hospital that has a detox, you're looking at hundreds of dollars a day. Now, if somebody is a drug dependent person, they don't have that kind of money. They have to be on Medicaid. They have to have parents that have health insurance. Programs are pretty good about getting federal and state funding to help with people pay for their stuff, for the rehab, but it's still a very difficult thing for people to approach. So the incidence and types of behavioral dependencies is another subject. Self-identified excessive exercising, sexual behavior, shopping, online, chatting, video gaming, and or eating tend to be fairly transient for most people. The main effect of time was found for each dependent behavior, indicating a moderately strong decrease in symptoms and severity across time, which I was really glad to read about that. Unless you have specific drug dependencies, or of course if you are obsessive compulsive, that doesn't help either. So the results of this is inconsistent with what we mostly think about drug dependencies. So that's kind of a good thing to know. So the major behavioral dependencies, the biggest one with substance abuse is sexual addiction. And as I said, with meth, it's huge because it affects, both of them affect the same part of the brain. And so the constant demand of having sexual activity is there, increased with the drug use. Online chatting, I missed that, was the first one. These social apps, huge thing. If you ever get a chance to watch the Netflix documentary about development of social apps, you will take them all off your phone. Trust me. It's real. I mean, we are being so manipulated, and we have been easy targets, especially kids. Exercise. I could use more of that. Video gaming and eating is down there, and the eating disorders include all the ones that you can think of off the top of your head, whether it's starving themselves, whether it's eating and throwing up, whether it's eating in general and continuing to eat. And Smart Recovery and the REBT works well. That's the new one you hear out, NOOM. That's what it's also based on, rational emotive behavioral therapy and cognitive behavioral therapy. They took that and running with it, and boy, they're making a fortune. Good for them, if it helps. Come on, please. Okay. The only behavioral addiction that is listed in the DSM-5 is gambling. None of the ones that I've talked to you about are considered a diagnosis. It's other activity. So hopefully sometime they come out with the DSM-6 and then we have to learn all this stuff all over again. They will begin to include more information as more studies have been done on these other behavioral activities. So it's been suggested that some conditions such as gambling disorder, compulsive stealing, compulsive buying, compulsive sexual behavior, and problem internet use with substance abuse disorders will be studied more extensively. So, a review of current popular recovery programs. So everybody has heard of AA, and there's other standard 12-step approach groups as well. There's like an AA for atheists, there's AA for non-believers. So there's a number of different versions of AA out there. And the 12-step approach asks members to admit their lack of control over their alcohol or whatever drug, and NA is also in this group. In order to cover, individuals are asked to turn themselves over to a higher power and find a spiritual awakening. The trouble I have with most of the people coming to me that say they've been to AA and it doesn't work for them and they've come to Smart Recovery meetings is they start out with re-emphasizing what their issue is, and it just does terrible things to their self-esteem. Hi, I'm Jane and I'm an alcoholic. Let's just reinforce that negative statement about themselves, because everybody has dependencies. Their self-esteem is below the floor. Smart Recovery is research-based, and it uses tools to help individuals change negative and defeating thoughts in order to enhance recovery from addiction. Women for Sobriety is a nonprofit organization that was funded in 1976. It's based on 13 acceptance statements that focus on positivity and responsibility for oneself and emotional growth. SOS. It's an alternative to 12-step programs. SOS prides itself on being its own entity and deriving from other secular or religious programs, not deriving from other secular or religious programs, and it continues to evolve with new research and does not subscribe to any one theory around surrounding addiction. LifeRing is another secular recovery program, provides support to individuals find their own way to sustaining sobriety and their own path in recovery. Moderation management. It states that alcohol abuse is a choice and a habit that can be changed with brief intervention strategies. It allows its members to choose alcohol in moderation or abstinence. Doesn't work for a lot of people. Also, there is Celebrate Recovery, Jewish Alcoholics, Moderation Management, Recovery Dharma, Refuge Recovery, and some of these are based on Buddhists, some of them are based on meditation. So there's a lot of different approaches out there that people generally are not aware of. And I just think as providers, it's really good to be able to offer people contemplating stopping whatever it is that they're doing that's affecting their lives, to know that they have choices. And in 2007, Smart Recovery took a state government to court for mandating that the only thing that they would accept was AA. And they got it made so that people can choose any recovery program that they want, which I think was a big boon for all the recovery programs. So the treatment outcomes from the literature. This is where it gets a little difficult, because finding studies like the one on behavior that I found and referenced was the only one I could really find specifically on behavioral dependencies. With the treatment programs, essentially, as long as the person is making a choice, and I want to reemphasize, it's their choice. You cannot force someone to go into recovery. It doesn't work. They cannot force you or anyone else. You can put them in a recovery program, and what happens when they come out? What's the first thing they do? They go use. It wasn't their choice. They need to make that choice. They have to finally be sick and tired of being sick and tired. It does not work when it's not what they want. And as I'll talk about tomorrow, this is what we teach the loved ones of people with dependencies. This is not about you nagging, bitching, moaning, complaining for them to quit doing what they do. That doesn't work. So we encourage people to say, you know, you need to read this stuff, look at it, see if it makes sense to you. If it doesn't, here's a list of other places, other programs that you could look at to see if that might work for you better. The focus of Smart Recovery is about choice. Some people do really well initially with following a 12-step program in conjunction with a secular behavior program. And then it's the combination. Some people really need that, you know, the strictness in the beginning until they kind of get it out of their system. Do you know how long it takes to recover from substance abuse? I'm not talking about the immediate detox period. I'm talking about for the brain and the body to get to the point of feeling more normal, 1 year to 2 years. That's a long time for people to continue to sustain their recovery. Detox, for the most part, is alcohol, because as we all know, and I used to take care of them in the ICU, they go, oh, here's a psych patient, this is yours. The respiratory depression, the seizures, having to get on a vent, the complete loss of consciousness, alcohol's the worst. The other drugs, for the most part, do not need to have a detox period like that. Okay, so the research. When we looked at, I took the best that I could find was a Cochrane review, which I figured that's about the biggest and best. I mean, right, in grad school, what did we all get? Research, 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 evidence-based, evidence-based, evidence-based. So when they look at patient populations greater than 18 with alcohol use, abuse, or dependence, all the same to me, outpatient treatment using AA or 12-step formulas compared to other clinical interventions, CBT, any of the behavioral modification things. The age range was from 34 to 51. Outcome: alcohol goals of lifetime total abstinence and higher group involvement at baseline were both strongly associated with better outcomes. Do you know how many people at 6 months are still in a group recovery program? Usually at least 75% have dropped out. At 1 year, 90% have dropped out. These are realistic statistics. So there's much research to support participation in 12-step groups as part of recovery. However, the benefits of 12-step participation may apply also to other mutual help groups, including secular groups that were analyzed in this study. So essentially, it's all comparable. And it goes back to what was the person's choice? What was it that they wanted to do? And then it's just matching up their personal philosophies. If they need religiously based, if they need peer group support, if they need the daily or weekly face-to-face type of supports. They need to have somebody other end of the phone to call, compared to thinking through and learning how to do their own self-management. And then the support groups, of which I said there's over 60 online, become learning opportunities for these people. And as time goes on and their brain starts to heal, they get better and better at learning what to do. So the outcome with support: high levels of participation, satisfaction, and cohesion among members of mutual alternatives suggest promise for these groups in addressing addiction problems. Addiction, not my word. I'm a one-person band, although there recently came out a statement from SAMHSA about changing the vocabulary, because when you hear addiction, everybody has a negative response. So we're trying to make it dependence. It's semantics, but it really does make a difference to the people involved. So the International Review of Self-Help Groups in Recovery from Alcohol Dependency demonstrate that they are an important, effective component of recovery. SMART. SMART is not 12-step. It is secular, so it's not religiously based, and it's based on evidence-based practice. And one of the differences is facilitators, which are called the group leaders, are trained. These are not mutual peers that are leading the groups. We are all trained facilitators that lead and essentially manage the people that are in the SMART recovery groups. I used to have a face-to-face meeting in Columbia, but with COVID hitting and I was doing it in the county health building, it got closed. So it's almost all online now. Some people are able to bring it back to face-to-face. They'll do it like in parks, big open air areas, because some people just do not like being online. I facilitate groups on Monday evening for family and friends and Friday evening for people in recovery. I will have anywhere, the family and friends, I'll have anywhere from 25 to 50 people in the meeting. The Friday evening meeting, I'll have anywhere from 90 to 200 people in that meeting. It's huge. And when COVID hit, the attendance exploded because local meetings were closing. And originally, I wasn't doing the Friday evening group, and so many of the facilitators were going, oh gosh, we need more groups, we need more facilitators, because we don't do more than 3 groups each week individually. So I added the Friday group, and there's another group that meets on Friday that's also very popular, and when they aren't there for some reason, they both had COVID, so their meeting was closed for several weeks. I get swamped. So it's a real trick. I know Zoom really, really well. GoToMeeting, it doesn't have as many options, and I'm not as familiar with it. So I do Zoom like 6 or 7 times a week. So go. So the history of SMART. In 1950s, rational emotive behavioral therapy was developed by Albert Ellis. And if you haven't had a chance to read his book, he is hysterical. He was also alcohol dependent. And so he was writing from his heart. And he used to be under Freud for like 5 years and decided that was a waste of time. Because going through all this past history with people and agonizing over different things ad nauseum for years at a time was not helping them. So he wanted to find a different way to do it. Jean Kirkpatrick founded Women for Sobriety, and that was the first secular alcohol recovery alternative to AA. In '94, the nonprofit board of Rational Recovery Self-Help incorporated as the Alcohol and Drug Abuse Self-Help Network, which eventually became SMART. So that's where we count our anniversary from. I think I said 76 earlier, I misspoke. So at the time in '95, there were 90 SMART recovery meetings, and for the most part, that was face-to-face. And then I told you about in 2007, the court ruling that they can't mandate only one recovery program for people to do. When people attend our meetings, they can get a verification letter that they take to their parole officers or whoever they have to answer to. And they go to the website, and Zoom is really good about tracking that for us, so we don't have to figure out who was in the meeting and not in the meeting. I mean, 200 people, how are you going to do that? And so they count. They have to be in the meeting at least 61 minutes to get a certificate of attendance for each particular meeting. So that's made our lives very much easier because we used to have to do them all out by hand. Smart Recovery has grown rapidly. This is our annual report from 2017. At that time, there were 1,700 facilitators that went to online training, and that was online training was whether it was to do face-to-face meetings or whether to do, we call it Smart Recovery Online or SROL. There were 1,400 meetings in the US and 1,000 international meetings. Then it went up, and this is more recent data, like 2019. Total meetings were up to 2,500 with 25 weekly online meetings. As of now, there's 65 online weekly meetings. And this is just the US one. This doesn't count Australia, Canada, no, Canada's part of us. Great Britain, oh, geez, there's Israel, South America. We just recently started several Asia programs. There's even in Russia. I mean, it's everywhere. It's really encouraging. So Smart Recovery's mission is to empower people to achieve independence from addiction problems with our science-based 4-point program. The vision is a fulfilling and meaningful addiction-free life for all. So the theories behind Smart Recovery, as I said, are REBT and CBT. The pioneering form of cognitive therapy was developed by Dr. Ellis in the 1950s. It's an action-oriented approach to managing cognitive, emotional, and behavioral disturbances. According to REBT, our thinking about events is what leads to emotional and behavioral upsets. Focusing on the present, individuals are taught how to examine and challenge their unhelpful thinking, which creates unhealthy emotions, self-defeating, and self-absorbing behaviors. How many of you go home at the end of the day and go, oh, I had a terrible, horrible, awful day? Happens all the time, right? Or I still have all that damn charting to do. I get it, I get it. I've been a nurse for 44 years. Yeah, is it 45 now? I don't know, I lose track. So then in 1960, Dr. Aaron Beck started cognitive behavioral therapy. And evidence has been shown it's effective for psychiatric problems, psychological disorders, and medical issues. Began with Dr. Watson, which I thought was kind of fun, Rosalie Rayner, and studies on behavior conditioning in the 1920s. So even way back then, they were starting to get the idea. I think Dr. Ellis was not the only one who had had enough of Freud. So cognitive behavioral therapy is a solution-based approach to treatment oriented towards solving problems and learning skills. I got to have the wonderful opportunity of seeing Dr. Beck in person in Philadelphia at his cognitive behavioral therapy organization. He's got a whole huge place where they train people and stuff. And at that time, he was 94. I can't imagine, and I know he hasn't died yet, but his daughter, Judith, has picked up a lot of the stuff in his place. So the 3-minute REBT. What do you need and what do you want? This is really the crux of how it goes. It's coping with urges, living a balanced life, and managing your thoughts. Your belief is, I must have what I want. Those brownies out there at break time that was not fair. Dispute. Is there any evidence that my belief is true? I have to admit, I had 1.5 brownies. But I made sure I walked after that, rationalizing. But, you know, is my life going to end if I don't eat that? No. Is it the most terrible, horrible, awful thing that could happen to me, like what's going on right now in the Gulf, where they're getting hit by their 11th storm? I'm just so glad we're not down there. The rational response, I can't find any. I want what I want, but there's no evidence that I have to have it. Dispute. What good can happen to me if I give up my belief? What's the payoff to change my thought process? I can feel free to have desire without disturbance. I'm more likely to get what I want because I'm not desperate, anxious, and depressed. I'm less likely to demand that others give me what I want. You're going to do what I say. Okay, kid, I don't think so. I'm less likely to demand from others what I want. Therefore, being less troublesome and dependent, I can be happier. I use this stuff all the time in my regular everyday life. So Smart Recovery's 4-point program. The first one is building, maintaining motivation. This is the crucial one where people are starting to make a choice. Do they want to keep doing what they're doing that's disrupting their life, is making everything around them horrible? Then it's coping with urges. And we teach people to start to identify their urges. What is it that is causing me to go in this direction? We encourage them to keep an urge log. Time, day, what were they doing, what happened? And they really start to look at piece by piece where their urges are coming from. And then managing thoughts, feelings, and behaviors. So they write in the last column, what is it that they did to take their mind off of going to that urge? And then living a balanced lifestyle is about what do they do with all their time if they're not seeking their drug, being high, wearing it off. We help them to see that they have other interests. They have other things that they have been wanting to do, but just haven't had the initiative, the time, the wherewithal to go do it. Fishing, crocheting, artwork, going back to school, getting a job, getting a place to live. I mean, these are things that they just really haven't focused on because it's not in their priorities. When we ask them what their biggest priorities in life are, those are the kind of things that they list: their kids, their family, having a job, place to live. And I go, wait a minute, where's your dependent substance? It's not on that list. Are you really living what is a priority to you? No, you're making a choice to sabotage yourself. These are things you really want to do, but you're choosing this instead, and that was not on your list of priorities. Something's not fitting here. There. So the 4 points of Smart Recovery follow the stages of change. And Proska and DiClemente developed this back in '84, and there had been several versions of this around beforehand. But I go through with people in the meetings, change just doesn't happen, boom, like this. You go through stages. It's just like the grief stages. And I go through that with family and friends because they've lost their loved one to something else. So these are the stages of change. And when I piece it together for people in a meeting, I do the comparison between the 4 steps of Smart Recovery and Proska's stages of change. So the building and maintaining motivation is the pre-contemplation and contemplation. Coping with urges is the stage of preparation. Managing thoughts, feelings, and behaviors is the action stage. And then living a balanced life is the maintenance stage. As I said, Smart Recovery is not considered to be a lifelong program like 12-step programs are. And the philosophy is because once you start living a balanced life, you don't need all that stuff anymore. And one of the things my clients tell me is that's so discouraging for them is maybe somebody's their sponsor and they crash. They go off the wagon. And they get essentially completely annihilated from that group. They are not allowed to participate. They're not allowed to be there. They're completely snubbed. What a great way to build somebody's self-esteem. Pull out the rug from underneath. In Smart Recovery, what we do is we call it a slip. We are human beings. Did everybody learn how to ride a bicycle the very first time they got on it? No. They had training wheels, they crashed, they did all these things. We're humans. This is how we learn. So to learn, we have to make mistakes and then correct what we did wrong and then go on from there to keep practicing what we've learned. Same thing with spending money, any of those things. There are handbooks for smart recovery, and there are two, and they're on the slide, and I have some out in the lobby at the desk, the check-in desk. My cost for these is $15. It has in here all the tools that I'm about to talk about for smart recovery, and then there's the one for family and friends as well. So this is the basic thing that we do, and they're available in other places besides the smart recovery website. However, like Amazon takes 30% of the profit, and this is the only place that Smart Recovery makes money because it's a total volunteer organization, except for the 4 people in the main office, the administrative and IT people who we couldn't function without. The CEO of the organization, the assistant CEO, none of these people are salaried. Everybody's a volunteer, which I find very heartening. It's not like some of the big, like United Way and all these guys making $500,000 a year. It's not like that. It is totally volunteer. So the Family and Friends program is also science-based, and it's a self-empowering solutions for families who also need to recover. And how do I get that to show up? Okay. This is one of my favorite things. It's about whose responsibility is what. And it's the same whether it's somebody that's in recovery or loved ones. This is your responsibility, your words, your behavior, your actions, your efforts, your mistakes, your ideas, and the consequences of your actions. What's not your responsibility? Everything else. Other people's actions, other people's ideas, other people's fears, consequences of other people's actions, other people's beliefs, other people's mistakes, other people's words. Common thing. They made me so mad. No, you let them make you mad. Now, it depends upon the source of the criticism. If it's somebody close to you, that's harder to deal with than somebody who's just passing by on the street. But if it's upsetting you, you're making the choice to let that upset you. And this is the basic thing that we do to teach people how to deal with their urges, because oftentimes it's coming from situations, work, other people. I got to have a drink because I just can't handle this. Quick, short-term, answer to their problem. No. Derek, no. Okay, I don't want to go there. Okay. Urges and gratification. This is one of my favorite things about Albert Ellis. He came up with this analogy of urges. You got the devil on one shoulder and an angel on the other. And the devil's going, it'll be fine. Just, have a drink. And, that's one of the things of AA I love is one is not enough and 100, no, one is enough, but 100's too many, or I always get it backwards. But essentially, the devil cons them into thinking, go ahead, you can handle it. It's no big deal. And the angel's on the other shoulder going, no, wait. Let's stop and think about this a minute. How's it going to be for you tomorrow if you have a hangover and you call in sick to work? And so there's this, and he describes this in his book. And then people will think about it. And they can't decide what to do. I love it. He calls that masturbation. They keep thinking and going back and forth of what to do. And then there's the should. I should do this. I should do that. He calls it they're shoulding all over themselves. He's just a clown to read. It was really fun. So dealing with urges. How long does an urge last? Anybody know? Usually the answer I get in, I do presentations in recovery facilities, and they'll go, days, weeks. Well, it can feel like that, but the act of escaping the trigger will focus your mind on something new, which will quickly lessen the urge. Urges and cravings into perspective, by understanding that they are normal, will pass in 7 to 15 minutes. So it's important for them to learn that. Problem is that they'll say, oh no, I keep having one after another after another. Well, yeah, in the beginning they can. It seems like, they just keep cycling back through this, and it takes time to change their behavior. It doesn't happen instantly overnight. So they have to practice it. We call it the 3 Ps: practice, patience, and persistence. And anything that helps them to learn their self-worth adds to it. Nope. Okay. I was talking a little bit ago about the hierarchy of values. That's where they look at what are the priorities in their life. And so we have them make a random list using this tool. This is an example of a tool. And we have them just randomly list down what are all the important things to themselves. This is a great exercise for us. This helps me get things done and get back on focus. So then we have them go down and prioritize in the bottom section. What are the top 5? Well, then the fun part is we put this into we call it the life wheel. And you can see how your life is out of balance if you're putting way too much time into just work. Okay, who's the worst of, self-care in professions? Us. We're very bad about self-care. So this helps put things into perspective. And it was really fun when I first did this to say, yeah, I really need to spend more time with my family. I'm a big time camper. For my birthday, I bought myself a camper. And, what kinds of things are you doing to enrich yourself and build your own self-esteem? So this is what we have them do. These are examples of meetings that are offered. These are the specialty ones. There's one just for mental health providers. That's on Sundays. Sexual maladaptive behavior, because it is a big issue. There's now one that's offered in Spanish. There are several beginner meetings for people that are just getting started with SMART. There's teen and youth, and there's several of those that aren't listed publicly but are available in local groups. And then several introductory meetings, and then eating behavior focused meetings. So they are trying to, branch out. There is a gambling one, but it's on hold. I'm not sure what happened to it. So this is an example of a schedule. This is a Sunday list. So you can see there's lots of varied times. I have mine listed by Central Standard Time. I'm originally from the East Coast, so I get the fact that when you go to sign up for a meeting that's on the East Coast, they don't put that it's Eastern Time. There's just no other time zone besides Eastern Time. I mean, what's the deal? So I just automatically assume it's Eastern Time, but Smart Recovery does have an option on their website where you can change it to your own time zones, because the biggest one that trips me up is Pacific Time and Australia. It drives me crazy. So these are examples of all the different meetings on a day that are available. There's Sunday and Monday. The ones that are in pink are all the family and friends meetings. And there's 8 of those now. It's very slowly growing. When I started doing mine a couple of years ago, I was only the 4th meeting in a week for family and friends, and we've now doubled that, which is great. Oops. This is what I talked about, the online attendance certification. This is so they can provide the letters to their parole officers or whoever they are. This is the contact information for Smart Recovery. It does have a .org contact for their website, and they are located in Illinois and Ohio. My contact information was on the first slide. I do therapy for people in recovery and for also loved ones or family and friends. And I cover all the state because I only do teletherapy. So a common one for me to get is, yeah, well, my son's at college and he's using and I don't know what to do. And they think they're going to come to me and get all kinds of solutions to how to fix their kid. And what I teach them instead is, okay, let's work on you first. And they're like, what? Yeah, no, that's the way it works. Questions?